And a warning this week about a new COVID strain expected to spread. I want to bring in Dr. David Winter from Baylor Scott & White Health. It is good to see you. Thank you for joining us. So let's start with the latest on the Omicron variant. What's going on? I'm seeing numbers spiking in Asia and in Europe now too.
Yeah, this new stealth variant, officially known as BA.2, it's spreading. A couple weeks ago, it was less than 10% of all the variants in America. It's up to 25%. In the Northeast, up in New York, New Jersey, it's 39%. So it's going up. It's more contagious than the original Omicron. That's why it's winning the battle out there. Fortunately, it looks like it's not more deadly, doesn't cause more serious illness. Now, still early to make that pronouncement, but that's what we see. Other good news, if you've had Omicron before, or you've been vaccinated, and are not frail or immunocompromised, and you come down with this new variant, you're going to have a very mild case. You're unlikely to get very, very sick. So there's some good news out there about the new variant.
Dr. Winter, I've read a lot of articles this week about those who have not had COVID yet. Let me knock on everything I've got here. But should we expect another COVID surge here in the States this spring or, going into summer? And, I'm thinking ahead to this fourth potential booster. What are your thoughts on that?
It's a very important question, Sonia, and I think right now it's anybody's guess. If you look at what's going on around the world, it's surging elsewhere. So some are saying it's going to come back right around the corner to America. That's one viewpoint. Others are saying, we found that the coronavirus spreads more rapidly in cold, dry climates, not in wet, humid climates, and not when it's a lot of sun. So that would say there should be some seasonal variation. It'll come around maybe in the fall and winter, but not this summer. Nobody knows right now. I think one thing is for sure, we're going to have more COVID in the years to come. That's for sure, I would think.
I think what I just heard you say is that I just need to move to a secluded island. Is that right? Yeah.
That would work.
That would work. Okay, so long COVID, and this is a serious issue for a lot of people. We've been hearing more about long COVID, so these are people who have lingering COVID symptoms for weeks and for months. I'm curious about any new data from ongoing studies on these patients because, Dr. Winter, I have a friend who still can't taste or smell, and especially smell, a year after she had COVID, and the bad news is she had a gas leak in her apartment, and so this created a really bad situation for her.
Well, in fact, a new study just 2 weeks ago in the journal Nature looked at folks who had COVID and previously had a brain scan for whatever reason. They had COVID, then they got another brain scan to compare. And what they found, surprisingly, there was some shrinkage of the brain, some tissue damage in the folks from the previous brain scan to the new one. Now, it was a small amount, 0.2 to 0.3%, not very, very much, and not everybody had that. We're not sure what that means right now. It's very concerning. I think the take-home message is don't get COVID if you can avoid it, because there is some brain damage in at least some folks in this new study.
All right, and those ongoing studies continue. We certainly continue to learn a lot more. Dr. David Winter, thank you so much for your time today.